Joining me now with more on the Israeli COVID vaccinations drive is Professor Manfred Green, Director for the Masters in Public Health program at the University of Haifa. Professor Green, thank you so much for being with us. Now, how will vaccinations affect the need for a shutdown? Will there even be a need for another shutdown if enough people get vaccinated between now and then?
Well, I think you've heard this before, but I'll repeat it, that we're at the beginning of the vaccination campaign, and most of the population are still non-vaccinated. They don't have antibodies, so they're not protected. So the virus can spread very easily. So we're really right at the beginning. You have to remember that we need to vaccinate anything upwards of 70 or more % in order to reach a stage where we reduce the transmission in the country and we get to a stage where we won't be having so many cases as we are right now. In any event, people will have to maintain the same kind of social distancing, wearing masks, and avoiding gatherings.
So really, I mean, assuming that we can get most of the public vaccinated by even the end of January, if we're being generous according to the schedule put forth by the government, so you're saying even months beyond that, we're probably going to have to continue with certain measure of hygiene restrictions. Am I understanding that correctly?
Sure. First of all, we're going to be doing something in this country which other countries are also doing, but they're going to be doing it at a slower pace probably. Some of them may be at the same pace, but we seem to be one of the countries that are doing it much faster. So we're still going to be in a world where that virus is going to be everywhere. So there are two problems. One is that there are still going to be people who have not been vaccinated. And remember that even people who have been vaccinated, this does not give 100% protection. So you've got to remember there's still a 5% or whatever of the population who are not protected. And we still have to evaluate that over time. So it's a very good start, but we need a lot of caution. We need to maintain we certainly need to maintain masks, and we need to maintain the regular social distancing. Okay. There are other things that we may then be able to relax at a later stage. Certainly we will, but certainly it's gradual.
So what do you now make, moving on a little bit, about the new rumors surrounding the new mutation of the coronavirus, the one basically shutting down travel from the UK and Australia and a number of other countries?
Okay, this is a virus. It's what's called an RNA virus, the genetic form. And these viruses do mutate. They replicate and they make mistakes and they mutate. So the virus generally does mutate anyway. And we've seen the mutations up to now. However, this is a significantly larger mutation, making it somewhat different from the current circulating virus. It doesn't mean, though, that that virus is going to cause more severe disease. And it doesn't mean that, in fact, it won't respond to the vaccine. They're very much related viruses. But it does mean that we have to be very careful. The longer the virus circulates in the world, generally, the more mutations there'll be. So that's why it's always good to try and get it under control. The optimists may say that the mutation might turn it into a less virulent. In other words, it may cause less severe disease. But we don't know. It could go either way.
Right. All right, well, kind of going deeper into something that you just said about this new mutation and the vaccine that is coming out, the Pfizer-BioNTech vaccine, how mutated does the coronavirus need to get before the vaccine is really inefficient? I mean, are we talking essentially about a new virus completely, or is that possible that the virus evolves or mutates quickly enough that this vaccine will be useless by the time enough people get it?
Well, we have to follow this very carefully, and we're still learning about that. But if you take the parallel with the influenza virus, which is a different family and a different virus, but the influenza virus is also an RNA virus, and it also mutates, but it mutates somewhat much more than the coronavirus, or at least in the time that we've seen it around. Mm-hmm. So what happens with the influenza virus is, as you know, that regularly each season we reevaluate the influenza virus and actually formulate a new vaccine. It doesn't mean that the previous vaccines are no good at all, but it means they're less effective. So there is a possibility always that at some stage there may have to be a reformulation of the coronavirus vaccine. At the moment, it doesn't seem that that mutation right now will require any kind of reformulation. It's probably going to be okay for the vaccine that we're using right now.
All right, Professor Green, thank you so much.
Thanks very much.